Hello everyone. This presentation is just going to provide a very brief summary of the Medicaid expansion occurring under the Patient Protection and Affordable Care Act passed in 2010, more commonly known as the ACA or Obamacare. This is by no means an exhaustive summary, but I am hoping it will be a quick refresher for those of you familiar with Medicaid expansion and provide a basic foundation for those of you who have not been following the turbulent implementation of healthcare reform. Like I said, this is just a basic summary. I'm not going to cover the history of the Medicaid program or delve into the specifics of funding. All of that information is covered in this week's reading and is summarized in the weekly PowerPoint. This is just the basics of the reform. Right now, Medicaid is a program covering some medical expenses for individuals, usually children, pregnant women, or disabled adults who fall below the poverty line. A few states already provide universal coverage for all impoverished individuals, though the determining level above the poverty line varies even between these states. Medicaid is partially funded by the state and partially funded by the federal government. Because this is not simply a federally funded program, Medicaid varies dramatically from state to state. Some states have even contracted private health insurance companies like Amerigroup or United Healthcare to manage Medicaid, which has caused even more variance in coverage and authorization requirements. There are a lot of problems with the current Medicaid system. Many people point to abuses of the system as the main culprit: greedy providers overbilling for services that weren't provided, or so-called lazy recipients requesting expensive supplies or tests because they have no financial obligation to pay for them. While there are definitely these types of abuses in the system, there are a lot of other problems. Inconsistent funding, varying eligibility requirements, and inconsistent standards of care plague the Medicaid system. The Affordable Care Act was introduced in 2010 with the dramatic promise that it would fix the Medicaid system. Not only would funding and standards of care issues be resolved, but the ACA promised to expand coverage to millions of Americans who are currently too rich to qualify for Medicaid, but too poor for health insurance. This was definitely a big promise. The ACA did develop some interesting ways to address the failures of the Medicaid system. The most important change was the expansion of Medicaid to cover all individuals who fall below 133% of the federal poverty line. This would automatically extend health care to over 15 million Americans who currently cannot afford insurance. The ACA also promised to improve quality by increasing provider fees to match those of Medicare, and, most importantly, promised to foot the bill for this dramatic expansion. As most of you know, the implementation of the ACA has not been smooth. The big issue for Medicaid expansion is funding. States that expand coverage will have 100% of the expansion costs covered by the federal government, but only for 2 years. After this initial window, federal funding is reduced by 10%, leaving states with a bill that is likely in the millions of dollars. The other issue implementation faces is that expansion of Medicaid, unlike the individual mandate, was not required. States were allowed to choose whether or not to expand Medicaid, and many states opted out of the program in protest of the Affordable Care Act. By leaving expansion of Medicaid in the hands of state legislators, millions of impoverished Americans are left without health care, but with a federal mandate requiring that they have health insurance. We really do not know how all of this is going to play out. What we do know is several issues face Americans and the economy today. Funding is certainly a huge issue, and the transition from 100% to 90% federal funding is a looming uncertainty. However, the biggest question is still, How will all of this affect the health of impoverished Americans? And what will states who did not expand Medicaid do to fill the gap left by the ACA? Thank you for taking the time to view this presentation. I certainly hope it provided some insight into the basics of Medicaid reform. Please remember to complete the reading for this week, post your original thread for the class discussion by Wednesday, and submit your article summary as early as possible. Have a great week, everyone.